Let's be honest. There's always a chance of going a little crazy when taking any psychoactive substance into your body. But psychedelics don't seem to be inherently dangerous, and even most difficult or even frightening experiences can often end up being helpful and informative once they're over and processed. There is now substantial scientific evidence that many of these substances are actually quite safe for a healthy, normal human mind, body, and spirit. But of course, that is a pretty general statement, and although psychedelics are not naturally dangerous or likely to make you crazy, we still have to be cautious and aware of any possible underlying conditions, be it physical, psychological, or otherwise, that could interact badly with any given substance. As well, knowing which medications, supplements, or foods that don't mix with whichever psychedelic substance is in question will help avoid collateral damage from something unrelated. Although cases are quite rare, it's worth noting that psychedelics have been documented to potentially trigger psychosis or persistent symptoms of psychosis in people who do have some of these predisposed risk factors, like a personal or a family history of severe mental illness, as well as in people who were not clearly predisposed. Now, the data is lacking and it doesn't tell us everything, but it does suggest caution with known contraindications is obviously important. It's also important to note here, though, that when individuals consider and align their personal setting and intention for psychedelic use, as well as the appropriate dosage, this could likely have an effect of significantly lowering the risks that come with psychedelic contraindications. It's wild to think that some ideas like psychedelics making you crazy or frying holes in your brain are so deeply ingrained in our cultural psyche, while MDMA, the subject of some of those claims of burning brain holes, is now entering phase 3 clinical trials and labeled a breakthrough therapy by the FDA. A lot of the core beliefs that people had about psychedelics over the last few decades have been rooted in complete falsehoods about their damage to our brains. But nowadays, many of the world's great minds are pulling back the veil. As Gerald Rosenbaum, director of the Center for Neuroscience of Psychedelics at Massachusetts General Hospital and professor of psychiatry at Harvard Medical School, said, one of the features of psychedelics is that they open up a window of what's called neuroplasticity, where you see evidence of neurons starting to bud and establish new connections. At the time of some of the earlier studies on psychedelics in the 1950s, neuroplasticity wasn't even an accepted theory, let alone neurogenesis, the process that Dr. Rosenbaum is referring to. Perhaps, despite their Schedule 1 label, these substances actually do the opposite of what we've so often been told. It's nice to have the peace of mind knowing that they are generally safe, but it's actually not uncommon for people to feel like they are going crazy during the experience. As Itai Danovich says in this interview with Everyday Health, intoxication with psychedelics can cause people to feel like they're losing their minds. In most cases, after the psychedelic agent is metabolized or eliminated from the body, the intoxication syndrome resolves and a clear sense of reality returns. Difficult experiences can be frightening, but it's helpful to remember that the effects are always temporary, and even if it feels like it will last forever, it won't. But this does illustrate why it's best not to take these substances too lightly and to make sure that we're in a good place mentally and emotionally, and that we know our reasons for taking a substance. And if we're looking to use these substances for healing or therapeutic purposes, then it is important to have these professional supports in place. Danovich went on to say in the interview, the therapeutic benefits of psychedelic drugs appear to depend on psychotherapy, which helps patients process the experience, develop insights, and pursue meaningful change. So don't let ideas like going crazy or frying your brain scare you off of psychedelics if you are serious about exploring these substances safely. But also don't let all the good news fool you into thinking that there's nothing to worry about. As perceptions about psychedelics change, the way that we think about using them can change too. Hopefully by breaking down both the fear and the excitement, we can take a more balanced approach to psychedelic substances in the future. By the way, those of you who are exploring psychedelic use for whatever purpose, the best way to minimize risks so that you can focus on cultivating the benefits is to follow a proven framework. The 7-step framework for psychedelic use is built on straightforward, down-to-earth harm reduction principles aimed to tackle the risks and challenges that people like you face navigating the world of psychedelics right now. There's a link in the description if you want to check that out. Guys, if you've heard some great myths about psychedelics, please share them in the comments. Give this video a like while you're down there, and if you liked this one, then check out one of these videos next.